Good morning, everyone again. Obviously, I am not Professor Roxana Meran, but I hope that you enjoy the presentation. As Dr. Bueno told before, cardiovascular disease is the leading cause of death in women in Europe, as being coronary heart disease the main cause for both sexes, as you can see in this graphic. As the same landscape in the USA, the prevalence of cardiovascular disease in USA affects many women. The number is terrible. It's like 43, is almost 43 million, and cardiovascular disease is the cause of death over chronic lung disease, lung cancer, and breast cancer. For Spain, every year, 9,000 women die more than men for the same cause, cardiovascular disease. And the mean average is 32%. I am talking about the map on the right side, and the communities that have a lower mean average of death due to cardiovascular disease are in yellow. Acute myocardial infarction has historically been regarded as men's disease, and for many years, acute myocardial infarction has been underdiagnosed and undertreated in women. However, the incidence of acute myocardial infarction is increasing in younger women, and the risk factors, traditional and non-traditional, affect with a very high impact in women. About the symptoms, women and men have many common symptoms in the presentation of acute myocardial infarction, and referring to women with atypical chest pain results in delayed diagnosis, undertreatment, and worse outcomes. Access to care for women is delayed, and it affects and impacts the reperfusions strategies, the application, and everything. The diagnosis of acute myocardial infarction in women is more difficult than for men, because there are, in many situations, there are no atherosclerotic causes as non-obstructive disease due to vasospasm, microvascular dysfunction, and ESCAD. The outcomes are worse for women, and secondary prevention for decreasing the recurrence is necessary, especially for women. In this presentation, we review the different aspects of these factors that influence the worst outcomes in women when they have an acute myocardial infarction. It's important to know that the incidence of acute myocardial infarction in young women is experiencing a high increase. As you can see in this study, where 2,008 patients were included, and 30% of them were young people with age under 55 years, and you can see that the incidence in women of acute myocardial infarction increased from 20% in 1995 to 32% in 2013. while in men is maintaining the same, and in the last years was decreasing. The traditional or classical risk factors affect in the same way women and men, but there are some of them that limited education and lower income that are more frequent in women. Other different or not traditional risk factors, as depression, is more frequent twice in women as compared to men. There are different and specific risk factors as preterm delivery, preeclampsia, gestational diabetes, autoimmune disease, and breast cancer, and the treatment derived from that are affecting especially to women. And in most of the series, around 50% of women with ischemic heart disease have more than 3 metabolic risk factors. And this is important to know how it impacts in the worst outcome. And it's especially, I would like to talk about the impact of gender and age in diabetic women. Diabetic women have a very worse prognosis than men when they have an acute myocardial infarction, as reflected in this study that included more than 30,000 patients, and where 26% were women. And you can see the mortality was higher in diabetic women in yellow as compared with diabetic men and women without diabetic for age groups except for those that were over 80 years. What about the differences in myocardial infarction symptoms? Classically, we think that women present more atypical symptoms than men, but this is not true in the whole way. In this huge study that includes more than 1 million of patients, where 47% of them were women, you can see that in the whole series, 42% of women, as compared to 31% of men, presented a myocardial infarction without symptoms, without chest pain. And this is it's repeated in all age groups, and the risk for present an MI without chest pain was 3 times higher, especially for women under 45 years. But I would like to talk about some special factors in this study that I analyzed. These women who presented without chest pain were sicker and far worse, more had diabetes, later presentation, and more were in Killit 3 and 4 when the chest pain was gone. Other studies more recently showed that young women had similar symptoms that men. Classically, also, the diagnosis of MI in women has been under the reality, and the use of high sensitivity troponin identified in this study recently published in JACC that identify 5 times more additional women than men with myocardial injury. Despite this, women receive fewer treatments for coronary artery disease than men, especially dual antiplatelet therapy and coronary revascularization, and after adjust this risk by confounding variables, women presented the outcomes worse than men. I present this local study that it was conducted in Catalonia, where the network my system is working. And you can see that in a number of 4,000 patients, it was observed that the delay in presentation for women was about 20 minutes more than men in order to achieve the reperfusion strategy. The number of patients that did not receive reperfusion was higher in women, 8.8% versus 5%, and in hospital mortality and mortality on 1 year was higher for women as compared to men. About the pathophysiology, non-obstructive coronary disease in acute coronary syndromes is more frequent in women than men. And as you can see in this graphic, where in this study analyzed the incidence of non-obstructive coronary disease. And you can see in red as female had more frequently non-obstructive coronary disease in STEMI, or non-STEMI, and unstable angina. Lower vascularization and underutilization of evidence-based treatments in women with STEMI is a reality. And this is studies very recently, only 4 years ago, was published, the Virgo study, one as a study. And young women with STEMI with eligible criteria for reperfusion therapy were less treated, 9% versus 4% men. And you can see the evolution in this graphic through a huge period. Women are in red, and this is are the patients that were undergoing to coronary angiography. Furthermore, women receive less treatment based on the evidence. As you can see in this Canadian registry of acute coronary syndromes, they receive less beta blocker, lipid-lowering ACE inhibitors, and the cardiac rehabilitation program was offered less frequently to women than men. And this is very important because the impact of cardiac rehabilitation programs on survival is very recognized, as you can see in this graphic, where you can observe that the survival increased in patients that were referred to a cardiac rehabilitation program. And in this study, we observed that less women than men were referred to these cardiac rehabilitation programs. How the cardiovascular disease mortality has evolutioned for the differences for sex through the period study in the USA is shown in this in this graphic. As you can see that the mortality due to cardiovascular disease was decreased, and unfortunately in 2011 the gap between both sexes was almost closed. But the National Health System in USA invests a lot of money in research on women. They made a great campaign with focus on women and cardiovascular disease risk and increase the application of evidence-based treatment. These are the factors that had influenced to close this gap. However, the reduction in myocardial infarction deaths was absent in young women, as you can see in this graphic, where from 230 patients, 230,000 patients, women were 26% of them. You can see as the death was similar for women through a period of 10 years. Now, to conclude, I would like to answer you the first question. What should we do in order to improve the treatment of acute coronary syndrome in women? I believed that we shouldn't have any difference between gender. By improving primary prevention and awareness of self-care in women, by improving the recognition of symptoms by women and professionals, by improving the medical care, novel lane transfer and reperfusion strategies, and by improving the access to rehabilitation programs. On the right, you can see an example from AHA campaign about the differences between both sexes to recognize the symptoms of acute myocardial infarction in women and men. And now, thank you for your attention, please.